my name is Jennifer Stillwell. This is Daniel, my son, and today we're going to be doing a full body assessment on him. Daniel, is it okay if we video this assessment for education?
Yes.
Okay, thank you. And I'm going to show around the room so you can see that there's no other materials available or anyone around. Okay, so we are going to begin with an inspection. Daniel, could you just turn towards me so we can just get a nice look at you? Very good. Now it looks like your face is nice and midline and symmetrical. You don't have any deformity, or you have a slight scar on your lip. It looks well healed. Your head shape appears to be very symmetrical and midline. Your ears also appear to be very symmetrical and midline, and even without any sort of deformity at all. Okay, we're gonna start. We're gonna start with your lymph nodes, beginning with your pre and post auricular. Here's your pre-auricular in front of your ear. Feels good. And your post auricular, which is behind your ears, down to the back of the head to the occipital node. Feeling good. Any tenderness so far?
Nope.
All right, we're gonna go up to the tonsillar, which are kind of like behind your jaw and your throatish area, down to your mandibular to your submental. Feels good. All right, and this is your posterior clavicular, cervical, not clavicular, cervical, posterior cervical. Here's your anterior cervical. Feeling good so far. Here's your supraclavicular, and I don't feel any nodes there. No pain yet?
Nope.
Awesome. Okay. And next we're going to check your facial cranial nerve and your trigeminal nerve. So I'm going to put my hands right here, and I want you to just kind of clench your jaw. Very good. It's bilateral and symmetrical in your strength doing that. Now I'm going to have you, we're going to check your facial nerve with number 7. First one was number 5, which is the trigeminal. This is going to be number 7, the facial nerve. So I'm going to have you close your eyes. And I'm going to run my finger across your forehead. Where am I touching? Oh, I just told you. I'm going to run my finger on your face. Where am I touching?
To my cheek, to my chin.
And now where?
To above my eyebrow.
And where now?
Down my nose.
And now?
To my cheek, to my east side of my cheek.
And where now?
Chin.
Oh, beautiful. Okay, you can open your eyes again. Wonderful. And now we're also going to check the cranial nerve number 12, the hypoglossal. I'm going to have you stick your tongue out and wiggle it back and forth. Perfect. It's symmetrical and even, and it's the same on both sides. All right, you can put your tongue back in your mouth now. So now I'm going to inspect your ears, and I can see from the front that they're even and midline. And from here, there's just pink and no redness and no drainage. This is nice and pink and no drainage. I'm going to go ahead and look in his ear using an otoscope and pulling the pinna up and away to get a good visual. Let me know if it's uncomfortable, okay?
Okay.
And it looks like the tympanic membrane is nice and pearly gray. There is no drainage. It's pink but not red. There is some cerumen in here, but it's not so bad I can't see the tympanic membrane. And it looks pretty good. All right, other side. And all right, once again, let me know if it's uncomfortable.
Okay.
And your tympanic membrane on this side is also pearly gray with no drainage. There's more cerumen than the first. It's a little more hard or difficult to visualize, but I can see it. There's no drainage, it's pink. And there's no swelling or anything like that. All right. Next, we are going to palpate your pinna and tragus, which is the outer ear area, and look for any nodules or swelling or lumps. And I don't feel anything. Your outer pinna here. Any pain when I do that?
Nope.
Okay, wonderful. And your tragus. That feels very nice. Very good. Okay. Next thing we're going to we're going to do an auditory test. So we're going to check cranial nerve number 8, which is your acoustic nerve. And I'm going to whisper a few secret words in your ear, and you have to tell me what I'm saying. But cover one ear.
I like pancakes.
All right, and now the other ear.
They taste good.
Very good. Wonderful. You have passed your acoustic auditory nerve test.
Yay.
And now we are going to check your mouth. And let's see, your lips look very nice. It looks like all your teeth are here and intact and white. Can I see your gums? Can you like this, please? Like a growl. Arr. Wonderful. And now I'm going to go ahead and put my light in my pocket. And we are going to look in your mouth and your buccal areas. Your spaces are very nice and pink. There's no patches or white or red. It's nice and moist without any sort of swelling or oozing. No white patches anywhere. Hard and soft palate are the same, nice and pink, no redness, no divots. Tonsils are, I would say, grade 2. They are present and I can see them, but they're not in the way or obstructing anything. Okay, I want you to stick out your tongue and say, ah. Wonderful. That is your cranial nerve number 10, your vagus, and also your cranial nerve number 9, which is your glossopharyngeal, which is your gag reflex, but we're not going to test that today. But your vagus nerve is intact because when you made noise, that your uvula raised symmetrically and perfectly, so it looks good. Could you just raise your tongue for me, please? Okay, it looks very nice. Looks good. And your teeth are all intact and no obvious caries. I'm just doing this so you don't shine any light in your mouth. All right, and looking good. We checked your number 12, so we checked that one already. Did we check your masseter? We already did that one, number 5. Let me just clench real quick so I can remember. Perfect. That's your cranial nerve number 5. Part of it anyway. So next thing we're going to do is look at your nose. I can see inspecting it is nice and midline and straight, no deviation of the septum from the outside. I'm going to check your frontal sinuses. Any pain?
Nope.
All right, wonderful. And I'm going to check your maxillary sinuses. Any pain?
Nope.
Wonderful. All right, now we're going to look inside your nose. An old otoscope. All right, very nice. Your turbinates are nice and pink. There's no drainage or lots of goop in there, no polyps. Your turbinates are very nice and pink and non-swelling and non-obstructed. And inside it looks like your septum is also quite straight. There's no excessive drainage, no polyps, it's nice and pink. And it's fogging up a little bit from your laughing. But it looks nice and healthy. Okay, so we checked your sinuses and we checked your outer nose. And we're going to check your, getting sleepy? All right, I'm going to check your optic reflex, your cranial nerve number 2, which is your optic reflex. All right, very good. It looks like your pupils are dilating and constricting very appropriately. And I'm going to do a peripheral eye check, okay? And I'm going to come in and you tell me when you see my fingers, okay?
When?
Oh, look at you.
When?
And I'm going to bring my hands in. Tell me when you see my fingers.
When?
Okay. And I'm also going to do a visual inspection of your eyes themselves. I'm going to bring your eyes down to the bottom and look at your conjunctiva, or conjunctiva, however you want to say it. It's very nice and pink, no swelling, no wateriness, no discharge. And then your sclera is nice and white and beautiful, bilaterally, very symmetric, gorgeous. All right, and then we're gonna look at your neck, and your neck from a visual inspection appears to be very straight, midline, no deviations that are obvious. I'm gonna palpate for any deviations, which I do not feel. The trachea is midline, very nice. I'm gonna check the carotid pulse, and it's there, and I don't feel any sort of thrill. Carotid pulse on this side, very nice, don't feel any sort of thrill. I'm going to listen with the bell of my stethoscope. Can you hold your breath for like 3 seconds? Perfect. All right, take the, there you go, beautiful. All right, one more. All right, beautiful. Okay, that's We're also going to palpate your neck here for your thyroid. Okay, I'm going to feel around here for thymus, thyroid, and I want you to do a nice swallow for me. All right, and again. Very good, feel it. And again. Wonderful. Okay, and I want you to do some neck flexion. So I want to see how you are with your head up and down, and then left and right. And I want you to do a nice rounded motion like this, and side to side. And we're going to check your cranial number 11 with the spinal accessory muscles. And I'm going to put my hands here, and I want you to push up against my hands. Perfect. Oh, you're so strong.
Yeah.
All right, and we'll finish up by doing the Snellen test, which is part of your optic nerve test. So I'm going to have you step right here on this tape, and we're going to cover one eye, and you're going to do your best to read the lowest line that you can read, and then we'll switch hands and try with the other hand, okay? Do you need more light, or is that enough light for you?
That's lovely.
Okay.
E L.
I'm going to change it to the side of the camera, okay?
E L T F P H O L C F D H G V S E P T Z O O
No
F
sneaking ahead.
O F B H J.
Okay, can't read the bottom line. That's right, switch hands.
You want me to read it again?
Just read the lowest line. You don't have to read the whole thing, just go down to the lowest one you can read.
G F B H J.
Okay, and now uncover your eyes and read, try it again, the lowest one you can read.
I can kind of read the L thing.
All right, go ahead, do your best.
I think that it's a L P P P H.
Okay. All right, you're almost there. I think we probably should follow up with an eye doctor, but you're almost to 2020, but not maybe quite. All right. All right. Have a seat again. All right, and come towards me again. And now I'm going to bring down to your arms. We're going to do some range of motion, some checking some pulse and things like that. All right, so first I'm going to check the capillary refill of your fingers, and I squeeze, and you get the circulation back very quickly. It's a brisk cap refill +2. It's great. Same with the other hand. Perfect. Now I'm going to check your radial pulse. Perfect. All right, I'm going to check your other one. Wonderful. Very good pulses. I'm going to check your deep tendon reflexes. Your favorite part, I know. The magic part. Okay, I'm going to have you relax your hand right there. Okay. And I'm going to just tap over my finger. Wait, let's get rid of them. And same thing on the other side. I want to get a good, yeah, there we go. And now we're going to check your patellars. All right, ready?
Whoa.
Oh, are you sure you're not being, are you doing that?
I'm doing it. So weird.
Right. And now I'm going to check your Achilles. And we're going to check here. You're going to dorsiflex. Very perfect. And same thing on this foot. Dorsiflexion. Oh, very good. Okay. And now what I want you to do is take my hands. And I want you to squeeze my hands. Oh, wow. That's my strength. That's like 5 out of 5 strength. All right. And now I want you to take your elbows. And you're going to bend this way and show extension and flexion. And then you're going to take your left arm and you're going to bring it straight out. And bring it back down. Some abduction and adduction. And we're just going to do some range of motion stuff here. Okay? Some elbow stuff. Out to the side. Your arm straight out. Perfect. All right. And now I would like to do some hand inspections. We're going to look at all your joints.
Joints.
Any problems with your joints?
Yeah.
No swelling? They hurt?
Kind of. Not really.
Oh,
They hurt sometimes.
I'm sorry. Well, there's no swelling in your hand, so that's good. And you had equal strength. And then bring your arms straight up like this. And I'm going to try to do this. You pull Whoa. That's very strong. 5 out of 5. Good. All right, so now I want you to bend your knees. Show me you can just kind of, just kick them straight out. All right, and push them down. Oh, good strength, good strength. 5 out of 5. And now I'm going to check your ankle strength to push down against my hand. Perfect. 5 out of 5. I'm going to do the other hand. Very good, Eric. And you know what I'm going to do bilateral, just so we have an equal. Perfect. And your feet look great. I don't see any edema. I don't see any blemishes. You have one little tiny itty bitty cut right there, but your toes look good. And let's check your ankle range of motion. Can you just move your ankle around for me? Perfect. Great rotation, up and down. And same with the other one. Rotate your ankle, bring it up and down. And then I want you to kick your knees out one at a time. All right, and then the other one. Very good. Alrighty, and I'm going to check the cap refill in your foot. Beautiful, very brisk. Less than 3 seconds, very brisk. Check your pedal pulses. Very good. +2. Very good, +2. All right, and now we're gonna have you up and lay down. We're gonna do some abdomen inspection before we come back and do your heart and lungs. So, is it okay if I expose your belly a little bit? All right.
Good.
Now we can see with visual inspection, as we always go visual first. It's a symmetrical belly. It's nice and flat. There's no real blemishes or scars. You do have a little birthmark right here. Is there a little line that did a kitty cat get you? You've got a little kitty cat scratch. It's very superficial, but it's there.
It's serious.
What's that?
It's serious.
It's very serious. Okay. So visual inspection is good. I'm going to go ahead and auscultate all 4 quadrants. Very good. I can hear sounds in the right lower quadrant. And now we're above the umbilicus in the right upper quadrant. Left upper quadrant. And left lower quadrant. Alright, I'm going to do some. We're going to auscultate the, actually we'll just keep going with this abdominal exam before we move any further. Okay, now we've listened, we can go ahead and percuss. We're checking for tympany dullness or flatness.
It's so weird.
Does it feel weird? No pain? Does it hurt anywhere? Because I'm smacking your belly a little bit?
Right here.
Right here. Does it hurt? So now I'm going to go into palpating because we percussed. And we didn't hear any sounds of inappropriate dullness. Okay. And now I'm going to check the general quadrants before I go for the liver and spleen. No pain? Just uncomfortable?
Like
Okay.
waking.
Oh, that's where you're. When was the last time you pooped?
Today.
Oh, okay. So I'm just checking for your liver. I'm going to check up against the bottom of your intercostal space here. All right. So I can not really feel it, but it's something that might be the bottom edge of it. So it's really tucked away in there. So I'm going to have you lean towards me just a little bit, and I'm going to sort of put my hand behind you and try to feel for your spleen. And I don't feel it, and that's good.
I have no spoon.
You have a spleen. It's in there. Okay, you can come back down. Now I'm going to go ahead and I'm going to listen to your abdominal aorta with the bell on my stethoscope and listen for any sort of bruise. And I'm going to listen to the right renal artery and left renal artery. All right, and the right iliac artery. And the left iliac. Okay, and while we're here, we'll check the Bloomberg side, which is taking your hand, going down, and no rebound. Did it hurt at all? No rebound tenderness, so that's a good sign. Okay, and now you can. You okay? Okay, now you can sit up. And I'm gonna have you sit in the chair again. And I'm gonna bring this whole chair forward a little bit so we can see you. Because we're gonna do a whole respiratory exam. So, there we go. Perfect. So now I'm gonna listen to your heart, and we're gonna do both the diaphragm and the bell of the stethoscope, and we're gonna listen to the aortic at the the second intercostal space on the right sternal border, the pulmonic, which is on the left sternal border at the second intercostal space. We have Erb's point at the third intercostal space on the left sternal border, the tricuspid valve at the fourth intercostal space on the left sternal border, and the mitral valve, which is the midclavicular line at the fifth intercostal space. I think I said we'll listen with the bell and the diaphragm of the stethoscope. Sorry. That's great. Hear both heart sounds, S1, S2. No evidence of murmurs, rubs, or gouts. Are you mugging at the camera right now?
No. I'm looking at the time.
Oh, okay. I'm gonna listen to your lungs now, starting with the front. Just relax. Just breathe normally. We're gonna start right here at the clavicles. Don't breathe too hard now. Don't get all air. Don't get no. Come on, just breathe regular.
Oh, my head.
And now on the back, we're gonna start suprascapular, and we're gonna start on the right side. Just breathe regular. You don't have to take big deep breaths. Breathe a little harder. Thank you.
Oh, the breathing.
And we're gonna on the sides here. Make sure to get that posterior lobe here on the right side. Okay, very good. Okay, lungs sound great. No agitation sounds. Wonderful.
Yay.
I'm not sure if we checked your accessory muscles. Yeah, did we check this one? All right. I want you to push up against my hands. Oh, perfect. You're so strong. Very good. That was your accessory muscles, spinal accessory muscle, which is number 11 of your cranial nerves. Okay, so now what we are going to do is have you hop up, and we're going to check some more range of motion. And what I would like you to do first is to bend down and try to touch your toes. Now I can see that your spine has a nice curve to it, just a visual inspection, and it appears to be very midline, no crookedness, no hunchbackedness or anything like that. Okay, I would like you to stand up and like sort of hyperextend, look up to the ceiling. Any pain there? Any problems with that? All right, now stand up straight and look forward. I'm just gonna palpate your spine for any lumps, bumps, bruises, or places that are out of. Sorry. All right, and now what I'd like to do is lift up your knee and lift your other knee. What like you to take your leg and bring it right out, kind of wiggle it around, do a nice range of motion here. I would like you to lift your knee against my hand. Very good, okay. And do some squats like this, like squat your knees, show that you can bend your knees, and then bend it out like this. Nice range of motion like that. Okay, and we did your ankles already. Now we've done your knees. Let's make sure your hips. I want you to wiggle your hips around and around. I want you to bring your legs straight out. Bring it back down. Very good. Okay, to do hand strength, can you squeeze my hands? Oh, it's 5 out of 5. So strong. I think we already did that, but because my hands still hurt. And now we're going to do the Romberg sign. So what we're going to do is test just your sort of ability to stand still with your eyes closed. I want you to close your eyes and we'll count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so you stayed afloat. You're a little wobbly, but I think for the most part you're okay.
That was weird.
Okay, so let's just do a little once over on you and make sure we got all the bits that we need to get. So your cranial nerves we checked. We didn't check number 1 because that's your olfactory, which is your smell. We did 2, which is your optic nerve. We did Snellen, and we did your pupillary test, and we did your peripheral. We did 3, 4, and 6 with your star shape, with your trochlear, and did we do that one? Let me make sure. So 3, 4, and 6. I want you to look at my finger, make a star shape. Just don't move your head. Just move your eyes. Just follow my finger with your eyes. Wonderful. That's your abducens, your trochlear, and your oculomotor nerve. Okay. And then number 5 was your
Gag?
we don't check your gag.
Yeah.
Oh, we checked your number 10. That would be number 9. So that's number 10. 5 is your trigeminal, and we already did 6. We just did 6 with the star. 7 is your facial. Let's see. We it said no 9 and 10. 8 is your auditory. We did the whisper test because you like pancakes. And 11 is shrug. 12 is your tongue. So we did all of your cranial nerves. Did we do any arm extensions? We did arm extensions.
Yep, I'm pretty sure.
Did you do hand extensions? Do you do hands?
I'll just do it now.
Do we do shoulder pulls like this? You show me how strong you are?
Yeah.
Okay, yeah, you did that. Okay, and let's see, we did tonsils, and you know your nose has been line. We did your tongue. We checked your belly. We checked your deep tendon reflexes. Oh, I know what you need. Did we do this?
No.
Okay, so show me how fast you can do this with your fingers. How fast can you go? Now do this. Then this. Then this. Nothing in my hands. Nothing in my hands, like a dealer, car dealer. There you go. Okay, awesome. And we twisted our hips to show we had great hip motion. And okay. And checked your. Hold on. Just relax, so I can just take a look at you. And we inspected your chest and saw that it was symmetrical and even. And did your L hands. And we checked your radial pulses. We checked your caprifill, right? Did we check your caprifill? We checked your fingers.
Yeah.
To make your joints are good. And I checked your caprifill on your fingers. Both of them are great. Great caprifill. And then we checked your dorsalis pedis pulses.
Yep, and you kept my caprifill on my toesies.
All right, and your leg skin looks great. Looks very straight. All of your skin looks without any sort of blemishes. And I think that's everything. I hope so. 29 minutes and 44 seconds.